Everyone, it's Amy, Old Book, New Look. Today is Tuesday, April 24th, 2012. Coming on to do an update. So yesterday, I had some emergency surgery. I had worked all night, Sunday night into Monday morning, and got home from work around 6:30 in the morning, came through the door, and was hit by a wave of abdominal pain. Really severe. Very unusual for me, very out of nowhere. I was fine all night at work. So I came in and tried moving around, at first thinking, what could it be? Maybe it's gas. But it wasn't. I tried going upstairs and using the bathroom. That wasn't the problem. Tried laying down in bed for a little bit, and it just got worse and worse and worse. So I said to my husband, I think I need to go back and go into the ER and check in. So I drove back to work and checked myself into the ER. And so here's the thing. I don't know if I talked about this in any of my other videos. I can't remember if I talked about this back in January. But at my six-month post-op appointment with my bariatric program, I had talked to the nurse practitioner about some pain that I was having off and on once in a while. And I would get some pain, like, kind of out of nowhere, but it wasn't too bad. It was like just enough to kind of take my breath away, like, ooh, what is that? And it would last, I'd move around a little bit or take a deep breath, and it would go away. So it wouldn't last more than like a few minutes. And it wasn't happening very often. Maybe a couple times a week or so. So she said, it could be gas. She said, but also because of the amount of weight that I've lost, there's a defect that can happen with people that have had Roux-en-Y gastric bypass surgery. And I'm going to try to explain this the way that she explained it to me. But I think it's called a Peterson's defect. And basically what happens, because of the new connections that they make, the connections are like this, and then as you lose weight and there's more room in your abdomen and there's more room for your intestines to move around, it creates like a hole that your intestines can go inside that hole and get stuck. And that's called the Peterson's defect, and it's something that can't be prevented because it's not a problem until you've lost a significant amount of weight, like over 100 pounds. And I've lost 160 so far. So she said it sounded like that could be a possibility. And basically what happens, your intestines will go in, and she said what it sounded like what was happening to me is they would go in, and then I'd move around or take a deep breath and they'd come back out. So she said it wasn't an immediate threat, but that if it started happening more often over a longer period of time and more severe pain, then I needed to come in right away to the ER to get a CT scan so they could try to diagnose it and make sure that that's what was happening. Because if you let it go and it is to the point where you're getting a lot of pain and you're not getting it taken care of, and your bowel or your intestine is stuck in there for a long period of time, that's what they call an internal hernia, and it can it'll cut off the blood supply to your intestine. Part of your intestine would be damaged and possibly die, and then you'd have to face having surgery to have your intestines resectioned. So that would be bad. So I've kept a close eye on it all this time, and honestly, it hasn't been happening at all, really, lately. Since I went in there, it's maybe happened like 2 times since then, 2 or 3 times in these several months since then. So it kind of happened out of nowhere yesterday morning, and I said, all right, I'm going back to work, checking in. I called my surgeon on the way, and he happened to already be at the hospital because Mondays are his days that he schedules his bariatric surgeries. So he said he'd come down and see me, and they were going to do a CT scan, but they ended up deciding against it because they said, because he's got a team of surgeons that work with him as well, that it sounded so much like that was what was going on with me that they didn't want to bother with the CT scan. They wanted to take me straight to the operating room because there's a chance with a CT scan that the internal hernia won't show, and you can have a negative CT scan and still have an internal hernia and be sent home thinking that it's gas pain when it's really an internal hernia, and then you face the problem of, if it's an internal hernia, it getting worse and it being stuck in there and the bowel dying off. So that is something they wanted to avoid. They said it would just be better for them to be able to go and do laparoscopy, which is they take a laparoscope or an instrument into one of my pre-existing surgical sites. So I had those, I think it was 5 incisions from my gastric bypass. They'd open up one of them, stick a scope in, take a look around. And that way, if they found, they'd be able to see everything. They'd be sure exactly what was going on with me. And if they found something, they could take care of it right then and there. And if it was the Peterson's defect, all they would have to do is sew up that hole, and that would be it. Very minor procedure. And they could also take a look at other things inside me, gallbladder, all my intestines, pretty much everything, and be sure of what was going on with me. So they decided that was what they wanted to do, and I agreed that that was a good idea. So that's what we did. I trust my surgeon 100%. He's very, very skilled, and I know he knows what he's doing. He fixes other surgeons' mistakes, and he has a lot of patients that come to him for revisions from problems that they had with other surgeons' work. So, and from working in the hospital, I know that he's got a great reputation. And so I trusted him 100%, and I really wasn't too nervous because of that. I guess I'm just at peace with this whole process. So, at any rate, I had the surgery around 1 o'clock yesterday, and it went well. I think it was about 45 minutes to an hour, maybe an hour. When I woke up, it took me a while to come out of the anesthesia this time. Probably because where I've lost so much weight, it's affecting me, my body and my systems differently, I think. Also, they wanted to watch me really carefully because apparently my heart rate was really low. But I think that since I've lost all this weight and I'm so physically active now, I think my resting heart rate is just normally very low now. I never thought to check my heart rate at rest before now, but when I was in the emergency room before the surgery, they were like, is your heart rate normally that low? Because it was coming back at 46, I think they said 46 beats a minute, which, I mean, people are usually, I think normal is 60 beats a minute. And, you know, a lot of people are more than that. So I was like, I don't know, I haven't checked it since, you know, in all this time. I've never thought to check my resting heart rate. My blood pressure was great. It was like 113 over 60 something. Yeah, that's about what it usually runs too. So that was kind of weird. I kind of freaked out about it at first, but then when I thought about more and I talked to them about how much exercise I do, all the running and the Zumba, they decided it wasn't a problem. But so in the PACU, in the recovery room, they were concerned because when I fall asleep, my heart rate would go even lower. And I was so groggy that I was sleeping a lot, and they just wanted to watch me. So they told me that it was a very, very minor procedure, very minor surgery. They did find the Peterson's defect. I did have that hole, so they sewed it up. And they also found an adhesive band that was formed, and basically adhesions, from what I've been told and from what I've read, adhesions are scar tissue, internal scar tissue that forms after any abdominal surgery. It's not specific to gastric bypass. If you have a hysterectomy or any type of abdominal surgery, gallbladder removal, kidney surgery, whatever it is, everybody forms adhesions to some point. Some people form more adhesions than other people, and it's not normally a problem. People don't know that they have them. Occasionally when you get older and the adhesions have had more and more time to form over time in your lifespan, people who have had abdominal surgeries when they were young and when they get really old might have abdominal pain because of the adhesions if they form to the point where they're getting in the way of your other organs or your intestines or whatever. So they found an adhesive band that had formed, that had grown, and thought that maybe my intestines maybe could have been getting kinked up in that too. So they cut that adhesive band and took it out. So I'm all fixed up inside. And my doctor said I shouldn't have any more problems after this. So I, wasn't expecting this at all. I'm really bummed out that I had to have this happen, but, it happened. It could have been worse. It could have been better. It could have been worse timing. I'm fortunate. I'm really grateful that it didn't get worse, that it was caught early, and it's all been taken care of, and I'm good, and so there's a lot to be thankful for. They offered to let me stay the night if I wanted to. They could have discharged me right from the recovery room, but where I was so out of it still, and they were still kind of monitoring me with my heart rate. They sent me upstairs to a bed in the main hospital just to keep an eye on me, and I was still so groggy in the recovery room that I'm glad they did that, because I wanted to know for me that I was going to be okay at home. So they sent me upstairs, gave me some oxycodone for the pain. I walked around. The pain from the surgery is minuscule compared to the pain from the gastric bypass. I mean, not that I was terribly, the gastric bypass I didn't think was the worst thing in the world, as, on a scale from things that I've had that have hurt in the past, as far as giving birth. And when I was a kid I had viral meningitis, and that was really painful. Anyway, so my point here is that this time, this surgery was even less painful than the gastric bypass. So I'm doing pretty well. I don't have any terrible pain. It's just mostly just really sore. And I kind of relate it to like when I work out really hard the next day after, when I get really bad sore muscles, it's kind of like that. So they sent me home with a script for oxycodone, but by the time we got discharged, all the pharmacies were closed, so we didn't fill it last night. I did fill it this morning, but I haven't taken any of it. I don't think I need it. It's certainly tolerable. I haven't even taken any Tylenol. I could, but I'm fine. I mean, I'm certainly sore and slow moving. And tired. I think after this I'm gonna go take a nap. But so they sent me home last night. They offered for me to stay the night, but said that I could go home if I wanted to, so I chose to go home. So that's my story. Trying to think what else I wanted to tell you about it. I guess that's it. I'm bummed out because I'm missing work. I think I'm gonna have to miss a week of work, which bums me out. But I work 3 10-hour shifts, so I already worked one of them, so really I'm only gonna miss, I think I'm gonna miss tonight and Wednesday night. Those are my other 2 this week, and then I'll probably miss my Sunday and Monday night shift next week, and then I'll go back to work. Because the doctor wanted me to come in early next week for a checkup, and he didn't want me to go back to work before then. So, but he said it'll be a quick recovery, so I'm anticipating being able to go back to work pretty quickly. After a week should be fine. So, but I'm also bummed out that I'm not going to be able to teach my Zumba class this week. Like, part of me wants to say screw it and do it anyway. Because I just feel like I'm sore. And it's in 2 days, so maybe I could still do it, but I'm not going to. Don't worry, I'm not going to. Because I know that my body needs to heal, and I need to rest, and so I'm not going to push it. So I'm bummed out that I'll have to cancel that. Because I really do look forward to that. And I'm still trying to get it going. It's a new class. I've only been doing it for 2 weeks. And I had people that had come last week that were going to bring people with them this week. So that's a bummer. But even more so than that, I'm really bummed out that I'm going to not be able to run the 5K I was going to run this Sunday. And I know I had said I was going to make another video about that, but I'll just talk about it briefly right now. I was going to run a 5K in Massachusetts on Sunday with 2 friends from high school in honor of another friend from high school who was diagnosed with stage 4 pancreatic and liver cancer back in July 2010. And we were doing we were going to run this 5K. That the 5K itself is to benefit pancreatic cancer research, and so we were going to do it in honor of our friend who's still fighting for her life, still fighting to live, and she's an absolute inspiration. You know, she has been through so much. She was diagnosed shortly after. I think she was only 26 when she was diagnosed, or around that age. And she's younger than I am. I think a year, maybe 2 years younger than I am. We were in Girl Scouts together. Her mother was our troop leader, and we did go to the same high school. She was a year or 2 behind me, but you know, we went to school all together in Massachusetts, and she lives in Maine now too. And she's been through a lot. had just recently been married, and they wanted to have kids. And pancreatic cancer, there's no cure for pancreatic cancer unless it's caught really, really, really early. So it's an important cause to be able to raise money toward research for this. It's not something that's typically diagnosed, that it's not something that younger people typically get. It's usually diagnosed in men over 60, I think. So anyway, I am really honored to be able to do this in honor of her. And I was able to raise over $300 toward the cause, so I'm really happy about that. And I'm just really bummed because I really wanted to participate. But I'm hoping that, we'll see how the week goes, but I'm hoping that I'm still going to be able to go down and be there to watch my other two friends run. So, yeah, that's it. I'm tired. I'm going to go take a nap, but I just want to come on and say thank you to everyone who gave me well wishes on Facebook. And I'm okay. Life is good. This is just a minor setback, so yeah, I'll see you guys soon. Have a good week. Bye.